Well, I think we've reached the top of the hour, so it's my great pleasure to welcome you to this webinar. I'll begin with just an overview of NIA, and then you'll get a chance to meet some of the other leadership across the Institute, and of course, most importantly, to address questions you'd like us to discuss with you. Next slide, please. This is just an overview which illustrates the congressional charge to the Institute when it was created in 1974. It leads a broad research spectrum, as you'll see, understanding the nature of aging at both behavioral, social, biological levels, as well as with a strong mission for training, development, and communication. We'll get to some details about our budget, but our total budget for this fiscal year is now about $4.2 billion, quite substantial. Next slide, please. So these bullets illustrate some of the aspects of the NIA mission: to conduct research, to be sure, spectrum, as I said, from molecular, genetic, through behavioral, social, economic aspects of aging, to foster training, career development of you and those of you at various stages in careers and research, and we hope careers directed towards aging, to provide the research resources and infrastructure to facilitate the research that you do, and also to disseminate information about advances and opportunities to a variety of audiences. Next slide, please. This is the organization structure of the Institute. I won't go through in detail, but you get to meet a number of these folks from our intramural and extramural divisions as the afternoon proceeds. Next, please. Some words about our budget. As noted in FY22, that's the fiscal year in which we live. The NIH overall budget was $45 billion. From prior year, that included some substantial increases in targeted areas, the most substantial and significant for us of which was an increase of some $289 million above the prior base for Alzheimer's disease related dementias research. But the increase for this year was also across all of our total base, and therefore profited opportunities for research across the full spectrum of NIA. Next, please. This shows really the quite remarkable increase in appropriations year upon year, shown from 2013 through the present fiscal year. As recently as 2015, we were around the area of $1.1 billion, now to some 4.2. This is a rate of increase that far exceeds that of any of the other institutes or centers at NIH over this epoch. Next, please. In large measure, though not exclusively, this was due, as I mentioned, to increases in targeted research for Alzheimer's and related dementias research. What you see here listed for each year is the congressional language targeting specific funds for each year. And you can see that, in particular, through 2016 through the present, in the range from some $289 to $425 million each year additively in this targeted area. Next slide, please. As a part of our mission to carry out our leadership role in AD and ADRD research, we've taken seriously the role not just of NIA, but of all the institutes across NIH, which have a great deal to offer to this research program. And one way in which we've done this, an attempt to recruit new people into the field of aging research.
When this is done, I just hop in the car and head out.
Lyndon, I think you need to mute. Thank you. Illustrated here is one of those programs in which we have provided supplements for Alzheimer's-related dementia research to any and all the institutes at NIH. The supplement grants, which themselves were not Alzheimer's targeted, but where there was room consistent with the subject matter and expertise of the investigator to move into the field of aging research, targeted at Alzheimer's and related dementias. In this past year, you can see this amounted to 267 supplements across nearly all of the institutes at NIH and about $89 million. And I stress that to any of you who are working, in addition to your aging components, in the province of other of the NIH institutes. This is an opportunity to expand your own work and to expand the workforce targeted towards AD and ADRD research. Next, please. As another metric of the fact that as we, over these past years, expanded our AD, ADRD research workforce, we paid great attention to recruiting new people into the field, as well as supporting those already committed to this area. And over these last 6 years, we have about 1/3 of all of the awards that were made in AD and ADRD that went to new and early stage investigators. That means individuals who did not have any prior large R1 level research support from NIH. And about 1/4 of the support went to what we have termed new to the field investigators. These are those who have never even applied for research through any mechanism at NIH in the area of AD and ADRD. So again, an incentive, a welcome encouragement of all of you who are thinking of working into this field, as well as other areas of aging research. Next, please. Another mechanism that I want you to be sure you're aware of is that of SBAR and STTR. This is the small business areas that are congressionally mandated as a percentage of our budget and that of all the NIH institutes. And because NIH's budget appropriation has increased so dramatically, and because the proportion legislated to go into SBAR and STTR has increased, you can see we've moved from some 27 million in 2013 now to 132 million last year, and an even larger amount this year. And this, I guess, would also serve to encourage you to think about ways in which commercialization through small business enterprise may be a part of what you're doing, a way to translate some of the work you're doing into this area, and a very active program in place with infrastructure and mentoring to help and assist you to looking at the opportunities for this kind of transition. Next, please. To share with you what our pay lines are at this stage of the fiscal year. This may change as the year goes along, but they won't go down. At this point, for the general pay line that is not targeted to AD and ADRD research, for the more common applications that is less than $500,000 in direct costs, we're at the 10th percentile. And reflecting what we and other institutes have made a priority over past years and continue to, you'll see that the new investigators, NI, and early stage investigator, ESIs, are given a higher pay line, 13 to 15% respectively. For the more expensive applications on the general pay line, the bar is set a bit higher. And you can see once again for AD and ADRD pay lines, we are higher at the 28th percentile with, again, still higher allocations for NI and ESI. Next, please. For the non-CSR reviews or non-percentile other areas of research which get priority scores, you can see here the priority scores in the general line and the ADRD line with, again, a differential. And I particularly point you to the career development awards and fellowships where we've made every effort with funds available to continue to make these a high priority to recruit, develop careers, train people, and retain them in the area of research that we support. Next, please. And finally, just some of the ways you can stay informed and in touch. We encourage you to do so, including subscribing to the blog, which will proactively let you see on a weekly basis, pretty much what we're doing, what's new, and communicate to you. But feel free to tap into any of these all the time. We sure encourage it. Next, please. And so it's my pleasure next to turn the podium over to Ken Santora, the director of our Division of Extramural Activities. Ken.
Thank you, Dr. Hodis. And I just first of all want to welcome everyone to our Early Career Researchers Symposium given by the National Institute on Aging. Again, my name is Ken Santora. I'm the director of the Division of Extramural Activities. And before I turn it over to my colleague, Maria Carranza, who is our training officer here, I just wanted to give you a quick overview of what is the Division of Extramural Activities. You probably hear this term, but really don't understand what that means because we're not a scientific division. And it's just, we are made up of 5 major offices. This is where the grants management office is located. So all your budget questions can be handled there. Our scientific review branch, in which all of the applications that come into the Institute are reviewed that don't go to the Center for Scientific Review. Those are more those targeted funding opportunities. Our Office of Strategic Extramural Programs. This is where is housed our small business and our training programs, which you'll hear a lot more about next from Maria. Our Office of Clinical Research, which, if you are doing any kind of clinical research, especially clinical trials, you'll get very familiar with the systems that we need to report your clinical trials, called CROMs. And finally, our Office of the Director, that's where housed where we publish all our funding opportunity announcements, our counsel, receipt and referral, and all the human subjects issues. So as you can probably tell, the DEA is really there to help you. And if you have any questions regarding any of those areas, you can please forward them to me. So now I'll turn it over to Maria for giving you an overview of our training program. Thank you.
Thank you, Ken, and good afternoon, everyone. Welcome to today's webinar. Next slide, please. Here's a brief overview of this part of the presentation. We will tell you about NIA's training and career development programs, and we will specifically talk about career transition awards, mentored career development awards, early stage investigator funding and programs, and finish by letting you know how you can connect with NIA. Next slide, please. NIA supports a wide variety of training and career development opportunities for students, early career investigators, and clinician researchers, both at the individual and institutional levels. Today, we're going to focus specifically on opportunities for early career researchers, such as advanced postdoctoral fellows and junior faculty. Next slide, please. The take-home message that we want you to have after this presentation is to please keep in touch with the NIA Training Office. My colleague, Jamie Lavick, and myself are the people behind the NIA training at nih.gov email. You are welcome to email us with any questions you may have, and we will be happy to point you in the right direction and answer your questions. We also invite you to browse our NIA training website, which has recently been updated. And we also invite you to sign up for the NIA training newsletter, which comes out once a month and which will keep you updated with any training and career development program publications or updates in policy. Next slide, please. We will begin our discussion with the NIA Career Transition Awards, which are specifically geared for postdocs and equivalent positions. You may all have heard about the K99 award, which is the most popular and receives the highest number of applications among the career development awards at NIA. We want to take this opportunity to let you know that NIA recently published a new career transition award opportunity called the K22, which is meant to be complementary to the K99 to allow for additional career transitions from NIA-funded postdocs. Next slide, please. In this slide, we would like to compare and contrast the K99 and the K22 opportunities, which have similarities but also certain differences. In terms of eligibility, it is common knowledge that the K99 opportunity requires applicants to have only up to 4 years of postdoctoral experience at the time of application, both at the initial submission and the resubmission. In contrast, the K22 opportunity is for postdocs with 2 to 8 years of postdoctoral experience. It's also very important to point out that these positions that the applicant is in must be mentored training postdoctoral positions regardless of the title, and that it is incumbent upon the applicant to provide evidence that their position is not yet independent. In terms of the postdoctoral funding opportunity, the K99 provides 1 to 2 years of postdoctoral funding. In contrast, the K22 opportunity does not provide funding for the postdoctoral research. Instead, it provides an approval letter that gives the applicant up to 1 year to secure a faculty position. And then both opportunities, the R00 and the K22, will provide 3 years of independent funding for the researcher. There are a few differences also in terms of the citizenship requirement. The parent K99 opportunity does not require applicants to be US citizens or permanent residents. However, the K22 opportunity does require citizenship or permanent residency. There's also a few differences in terms of the costs that are covered at the independent phase. For the R00, the budget is $249,000 in direct costs per year, whereas for the K22 opportunity, it is about $150,000 per year. So we invite you to get to know more information about these opportunities by browsing our NIA Career Development Awards webpage. Next slide, please. In this slide, we just want to show you that in addition to the parent K99 R00, NIA participates in a variety of K99 R00 opportunities that have specific foci in terms of the research components that they fund, as well as the target population of applicants that they are geared towards. So we invite you to take a look at our website for additional information. We are also very happy to let you know that NIA is now the first institute at NIH to have K99 sample applications on our website. So we invite you to browse those if you are interested in submitting either a K99 or a K22 opportunity. This will prove very helpful as you write your application. Next slide, please. We wanted to provide a little bit of advice in terms of career transition awards. And the first piece of advice is that it's in the name. So the career development plan and your panel of advisors are just as important as your research plan. So it's really important that you spend time really developing and tailoring this career development plan to yourself and to your own specific career goals. It's also very important to remember that you need to describe both the postdoctoral and independent portion of your award in the initial application, and that both you and your postdoctoral advisor should explain clearly your plans for the applicant to transition to career independence. And as always, please plan to apply early to allow enough time for resubmission, especially for the K-99 opportunity, which has a more narrow eligibility window. Next slide, please. Now we're going to move on to the NIA Mentored Career Development Awards for early career faculty and sometimes postdocs. Next slide, please. Mentored Career Development, or K Awards, have many characteristics in common, and here you can see the different designations for these awards. The K76 or Bison Award is slightly different, and we will talk about it in just a few minutes. But in general, all Mentored Career Development or K Awards provide up to 5 years in funding and provide a salary ranging between $75,000 and $100,000 per year, and require the awardee to devote 75% of their effort to the K activities. Research support varies between $20,000 to $40,000, and all of these K awards require the applicant to be a U.S. citizen or permanent resident at the time of the award. For many of these, you can apply as a postdoc, but some of these may require a faculty position at the time of award. Next slide, please. In this slide, you can see the names and more details of NIA's Mentored K Awards. The more general one is the K01 award, but this one indeed requires that the applicant hold a faculty position at the time of award. However, that faculty position may or may not be tenure track. The K08 and K23 opportunities are specifically geared for clinician scientists conducting translational, clinical, and patient-oriented research. The K18 award is a special opportunity for translational researchers working on pain therapies. And the K25 award is open to quantitative scientists without prior wet lab research background coming into aging research. Next slide, please. The K76 or Bison Award is another flagship award from NIA, and it's geared mostly towards clinician scientists who must hold an early stage investigator status throughout their award. Applicants also must have held faculty level research support as opposed to the other Mentored K awards, and this research support could have been an R03, an R21, or private funding. And applicants must show evidence of past leadership and a commitment to future leadership in aging research. In terms of the budget, the award provides up to $225,000 per year, covering both salary and research support. And for more details about the budgetary allowances of the Bison Award, we invite you to check out our recent Bison Scholar blog post on the NIA website. In addition, Bison Scholars get to participate in the annual Bison Scholars meeting, which is hosted by the American Federation of Aging Research. Next slide, please. So just a little bit of advice in terms of NIA Career Development Awards. Once again, the career development plan, your panel of advisors, is just as important as your research plan. And it's really important to remember that reviewers will want you to justify the need for an additional 5 years of career development and training in aging, in addition to your research plans. It's also important to remember that K awards are reviewed internally at NIA, and that these panels may have broad expertise. So it's really important to put your career accomplishments in context for reviewers so that they understand what your accomplishments, that is your number of papers, your presentations, the types of journals that you publish in, what does that mean for someone in your particular discipline? And finally, it's very important that your research and career development have a very clear aging relevance, as that will be something that reviewers will be looking out for. Next slide, please. Now we will talk about early stage investigator funding and several programs for early career faculty. Next slide. And we will touch upon two definitions that Dr. Horas mentioned at the beginning of this presentation. And the first is early stage investigator, which is an investigator who has not received R01 or equivalent funding from NIH, and who is within the first 10 years of their terminal, after finishing their terminal degree. A new investigator is someone who has not received R01 or equivalent funding, but who may be beyond the 10 years after their terminal degree. It's very important to note that there are extensions available for this ESI status for different reasons, and we encourage you to visit the NIH ESI frequently asked questions and website to see if you qualify for one of these extensions. You are also invited to be aware of the list of the NIH grants that an investigator can hold and still be considered an ESI. And as always, we invite you to please keep your ERA Commons profile updated so that your awards may be considered as an ESI or NI type of award. Next slide, please. And why is this status so important? As Dr. Horas mentioned, applications from new and early stage investigators are among NIA's highest priorities and therefore will be considered at better pay lines than regular awards. And as an example here is, again, NIA's fiscal year 22 pay lines as they are at the moment. So please make sure that your status is updated so that you can take advantage of this designation. Next slide, please. One out of many opportunities that are available to early stage investigators is the CATS ESI R01 award, which requires applicant to have early stage investigator status at the time of application, and it's geared toward highly innovative projects that represent a change in research direction for the PI. In addition, no preliminary data is allowed and no preliminary data should exist. So that is one very important consideration when deciding if the CATS R01 opportunity is for you. Please know that applications will be administratively withdrawn if preliminary data is included. So please make sure that in your applications, all of your graphics and all of your sources are accompanied by the appropriate citation, both in the graphic legend and in the narrative of your application to make it clear that this is not preliminary data, but data that is publicly available, which is allowed in your application. Next slide, please. In addition, as you are deciding which research mechanism might be good for you, we want to make sure that you're aware that in addition to the typical R01 awards, there are other research program grants that are available at NIA that include the R21 exploratory or developmental grants and the R03 small research grants. And these awards are here to stimulate and to facilitate the entry of promising new investigators into aging research, and also to encourage established investigators to enter new areas of research on aging. And these grants are funded in all NIA-supported program areas, so we invite you to visit our website so that you can see all of the NIA-specific opportunities in addition to the parent grant opportunities. Next slide, please. We will end with some general advice about applying for research grants at NIA. And the first one is to choose the funding opportunity announcement that you will respond to wisely. And once you do so, to read the entire funding opportunity announcement and to plan to apply early. It's also very important to write your application as a researcher, but to edit your application as a reviewer. And to make sure that when you're editing your application, you put on the reviewer hat and make sure that you're addressing all of the review criteria that are listed as bullet points in the FOA. It's also very important that you identify and leverage your collaborators and their resources, as reviewers will want to see that you are surrounded by the right expertise to be able to conduct and be successful in your research. We also encourage you to get to know your institutional officials, both at your institution and also at NIA. Remember that your award goes to the institution, so it's very important that you are aware of the internal deadlines of your Office of Sponsor Research, and so that you can make sure that your applications are submitted on time and completely. And also at NIA, we encourage everyone to send us a draft or an overview of their specific aims, and NIA Training will be happy to connect you with the right program official who can provide you with feedback before you submit your application. We also encourage you to use NIH's extensive resources, which include sample applications that are available publicly online, as well as the myriad of tutorials that NIH has available for applicants, which include podcasts and a YouTube channel with all the information you could possibly think of that you need before submitting an application. Next slide, please. Finally, we will end this part of the presentation by inviting you again to follow us and to subscribe to our blog, which comes out weekly, and to also subscribe to the NIA Training newsletter, which comes out monthly, as well as to follow us on Twitter for up-to-date NIA research news. And with that, I will yield the floor to our next presenter, who is Dr. Patricia Jones.
Thank you, Dr. Carranza, and I echo my colleagues' greetings and welcome you to this afternoon's session. As Maria said, I'm Patricia Jones, and I'm the Director for the Office of Special Populations. Next slide, please. Just to pivot a bit from the very helpful information Maria shared regarding our training mechanisms, I just want to take a moment to describe our Office of Special Populations. We are situated among a suite of offices within our OD, and the specific role and responsibility of OSP is to catalyze and leverage the science across NIA, across the agency, across the Department of Health and Human Services, and more broadly, in the areas of health disparities, minority health, and workforce diversity, equity, inclusion, and accessibility research activities. We are focused on addressing the challenges of historically underrepresented scientists and advancing NIH's efforts to advance biomedical research. Next slide, please. From an organizational perspective, OSP has a scientific focus. And as I noted, we are among several other offices that make up the suite of the OD. We do coordinate activities, research, as well as meeting spaces as it relates to minority health, health disparities, and diversity, equity, inclusion. We represent the agency in terms of social determinants of health and other forums. And we have the opportunity to work closely with our council, specifically our task force on minority aging research, and support that particular component of the council as the executive secretary. Next slide, please. Some of you may be familiar with the Butler-Williams Scholars Program, but for those that may not be aware, the Butler-Williams Scholars Program is a little different from some of the training programs that Dr. Carranza described, in that it does not provide funding. It's not a grant, but it does stand on a long history of over 30 plus years of providing an intensive training exposure. It was formerly known as the Summer Institute on Aging, and in 2013, it was renamed in honor of the first two institute directors and continues with that name today. We do have an opportunity to also, as an office, represent and work closely with Dr. Hodis as he's bringing forward the Institute in our regional meetings, where we work closely with institutions that are lesser funded in NIA. We are in the progress of planning the meeting for this particular calendar year, but last year we did work closely with the University of Puerto Rico Medical Sciences Campus, and they collaborated with 15 other institutions on the island to host the meeting. Prior to that, Meharry Medical College, in partnership with Vanderbilt University Medical Center, co-hosted the meeting. As I mentioned, we do support the Task Force on Minority Aging Research. Some of our other offices' contributions in this space is we've worked closely with them in terms of conducting portfolio analysis and distilling the information gleaned from that. Many of you are probably familiar with the Health Disparities Research Framework that is displayed on our website. That framework is an activity that came as a suggestion of our council, and I'll say a few words about that shortly. Next slide, please. In addition to the activities that the Office of Special Populations supports that I just described, we also have an opportunity to collaborate across our programmatic divisions and bring forward a number of funding opportunity announcements or provide a leadership role in terms of our trans-agency funding efforts. And one example is our structural racism funding opportunity led by the National Institute of Minority Health and Health Disparities. This particular RFA had over 25 institutes and centers and offices that signed on, and NIA was among them. In addition, we have co-authored a number of peer-reviewed publications and blogs that address health disparities, minority health, or scientific diversity. We do have an opportunity to bring forward several presentations in many different forums, workshops, and meetings. And we've had opportunity to co-host different activities. Namely, in 2021, we led the inaugural offering of the NIH Rural Health Day, where we explored structural level determinants of health. And we will be co-hosting with NIAMS, a sister institute, a workshop to explore the health disparities in osteoarthritis. Next slide, please. Just to take a moment to say a few words about the Butler-Williams Scholars Program, because as I mentioned, it is one of our premier trainings that the Institute has offered since 1986-87. This is continues to be a very, very competitive program where we engage investigators that reflect research interests across the full spectrum from basic science through public health and population level science. The alumni do go on to be quite successful in securing other NIH awards and grants. They do move forward and represent a number of different institutes in terms of publications and take on leadership roles in different societies and environments. So we're quite pleased at the success rate of our Butler-Williams Scholars Program alum as they continue to take on and be excellent representatives of aging research. The last 2 calendar years, we've offered the training as a virtual offering due to the global pandemic, and this year we are planning to do the same. But I'm very pleased to report that the change in format has not stymied or limited the level of interest or enthusiasm by any stretch. People continue to be very, very interested, and we've just recently announced those who were selected to participate in the 2022 cohort convening this August. I will say that one change that has proven to be quite effective is that we've had the opportunity to refresh and further emphasize the integration of health disparities research in the curriculum as it pertains to the specific aims each scholar brings forward to the program. Next slide, please. To that end, as I mentioned, we will be offering the training remotely August 23 to 24, but for those that may be interested going forward, we do provide information, tips on how to prepare your application, things you might consider in preparing early on. And it is not uncommon for applicants to have to pursue more than one time. So we do encourage people to take the opportunity to read more about the program well in advance of when the next training offering is offered. Next slide, please. And I will close now and turn to my colleague. Thank you, Dr. Plood.
Sorry, thanks, Patricia. And I stood up instead of sitting down, so my camera's off. Anyway, I'm Dana Plood with the Division of Behavioral and Social Research. I'm going to provide a whirlwind tour overview of the division, and we can follow up later during the breakout chats to answer whatever questions you might have. Next slide, please. BSR supports research in training on social, psychological, economic, and behavioral processes of aging at the individual and population level. And over the past 6 years, our investments in AD-related research has increased substantially, as mentioned by Dr. Hodis earlier. And the figure on the right shows the research themes addressed in that context, and I'll circle back to that a little bit later in my presentation. Our division also supports various data resources, research networks, and centers. Next slide, please. Our division consists of 2 branches, the individual behavioral processes branch and the social processes Population and Social Processes branch. The division also has other offices, the Office of the Director, the Office of Data Resources and Analytics, which supports a range of infrastructure and data linkage activities, and the Office of Behavioral and Social Clinical Trials, which supports clinical trial activities across the division. And the two branches just lists the different program officers in those divisions and their areas of focus. Next slide, please. Every 5 years, a subcommittee of the National Advisory Council on Aging, comprised of distinguished scientists from a variety of disciplines that represent BSR's research portfolio, is convened to review the division's progress and provide recommendations for focus in the next 5 to 10 years. The 2019 report is summarized here. The topics are diverse and range from better understanding health disparities to reducing barriers to accessing data resources for research. And there's a link that you can click to get the full report online. Next, please. Overall, the goal of our division is to support multidisciplinary research across the lifespan. And the next few slides provide a sampling of some of this activity. Next, please. One of our major infrastructure projects is the Health and Retirement Study, HRS, the purpose of which is to design, collect, and distribute high-quality, multidisciplinary, longitudinal data to support research on aging and the health and well-being of the older population. Importantly, when the data are available, they're made public with no embargo period, and there are recently also genotyping data that can be obtained through the Gateway to Global Aging. Next, please. We also support additional longitudinal biosocial surveys collectively spanning the full lifespan that are rich in psychological, social, behavioral, and biological content, often bringing participants into clinics or neuroscience labs for health, performance, and imaging protocols. These investments allow the study of integrative pathways, linking social environments, psychological processes, and physical health. And the data sharing is a key feature of all of these studies, and just a sampling of them is shown in this slide. Next, please. Since 2009, we've promoted a range of innovation in emerging fields of behavioral and social science research, from decision neuroscience to social genomics. Across these fields, we've seen a few common solutions. We support these activities through this R24, U24 activity code. So these networks have some common themes. Some of the networks are shown here. They're all listed on our website. One of the themes, though, is that most of the emerging fields require some transdisciplinary collaboration. And these networks provide a kind of hotbed for those kinds of collaborations to take place. They involve teams working together and breaking down silos and developing common conceptual frameworks that enable progress in the given field. These networks also build infrastructure and tools that can help foster a more integrated cumulative science, often focusing on precise measurement and approaches to testing causal hypotheses, and doing the hard work of developing and documenting tools that can be used by the field at large. Next, please. Division also supports several center programs, the Roybal Centers for Translational Research, the Resource Centers for Minority Aging Research, and the Centers on Demography and Economics of Aging. And each program supports both mainstream research on aging as well as centers that focus on Alzheimer's disease and related dementias. Each center program has a coordinating center that serves as a sort of a central hub for the collection of centers that are supported. And so you can look at the coordinating center and see the list of participating centers as a reference point. As well, there's another resource supported by NIA, the Research Centers Collaborative Network, rccn-aging.org, if you wanted to look it up, that is useful for getting information about all of NIA's centers programs. And there was just a workshop sponsored by the RCCN yesterday, in which some of my colleagues here participated. And that those workshops and other webinar activities and other sorts of resources are available and archived on the RCCN Aging website. Next slide, please. As noted earlier, over the past 5 or 6 years, the BSR has increased its support of Alzheimer's disease-related research, and this figure shows the main themes of that investment, starting at the top of the figure and moving clockwise. Their health disparities, cognitive dementia epidemiology, behavioral and social pathways, early psychological changes, prevention, caregiver research, dementia care, and in the middle, there's a circle that shows the research resources that are related to all of these different themes. Next slide, please. This slide shows different ways that you can get in touch with us. We actually have a Twitter feed as well. And I encourage you to make use of these resources, and thank you for your time. And I get to turn it over to my colleague, Basil.
Great, thanks so much, Dana. I'd like to give you a brief overview of the Division of Geriatrics and Clinical Gerontology. Next slide, please. This is how we're organized. Our main research focus is supporting studies on health and disease in the aged, that's the geriatrics part, and also aging over the human lifespan, that's the clinical gerontology part, including relationships to health outcomes. Our director is Evan Hadley, Deputy Director Winnie Rossi, and I'll talk about the three funding divisions, but I'd also like to mention Rosalie Correa de Raja, who is a Senior Scientific Advisor to our Director. If you can go to the next slide, please. Rosalie conceived and heads the Aging Research Biobank, which is a terrific resource that maintains a collection of biospecimens and associated data with several of GCG's longitudinal cohort studies and clinical trials, including here, LifeSwan, the study of osteoporotic fractures, Mr. Oz testosterone trials, and this collection is growing. So if you're interested in learning more or accessing the biospecimens and data, please visit the website or reach out to Rosalie. Next slide, please. Our three funding divisions are the geriatrics branch, the clinical gerontology branch, and our clinical trials branch. And I'll start with the geriatrics branch. Next slide, please. Our focus is clinical, translational, and epidemiologic research on health and disease in the aged population and geriatric populations. And this is just an overview of many, but not all of the areas that we fund. Geriatric syndromes, disability, multiple chronic conditions, resilience, symptoms in older age like pain, fatigue, fatigability, age-related changes in clinical or functional disease outcomes. And this relates to our support of studies, of aging studies in a variety of clinical disciplines, medical and surgical disciplines, including geriatrics and general internal medicine and others, as well as other clinical specialties, nursing, pharmacy, physical therapy, occupational therapy, speech-language pathology. We have a robust and growing program in supporting aging research in these clinical disciplines. And also a very large part of our portfolio includes research on physical activity in disease and disability. Next slide, please. These are the four program officers that comprise the geriatrics branch. Lyndon Joseph is an exercise physiologist by training, and you see here his many portfolio areas, including musculoskeletal conditions, physical activity, and sedentary behavior, gait biomechanics, fall prevention, testosterone, and metabolism. Sue Zeman is a geriatric cardiologist, and so she holds the cardiovascular disease portfolio primarily, as well as related areas, and she's also our main point person for a liaison to the many clinical specialties listed here, as well as our portfolio on delirium. Marcel Salive is a preventive medicine specialist with additional training in clinical epidemiology, and he is the main point person for multiple chronic conditions, deprescribing, and many others here, as you can see. I'm primarily responsible for the Pepper Centers, palliative care, pain, fatigue, and fatigability research, and many others. Next slide, please. We also have a clinical gerontology branch. You can move to the next slide, please. And that branch focuses on aging across the lifespan. You can see the many portfolio areas here, including clinical and translational research on healthy aging, as well as a very significant focus on exceptional longevity. Next slide, please. The program officers are Chanda Dutta, who is the chief of that branch, and Nalini Raghavachari, program officer in the branch, who leads many of the longevity research areas. Next slide, please. Then finally, our clinical trials branch. Next slide, please. Our clinical trials branch focuses on larger scale clinical trials, and you see many of the areas here. Next slide, please. The branch is led by Sergei Romashkin, the chief of the branch, and his three program colleagues, Barbara Radachevska, Maggie Nalisari, and Irina Sasanova, who focuses specifically on geroscience type clinical trials. Next slide, please. That's the end. You can visit us at that website here to learn more. Thanks very much.
All right, thank you for joining us today. I'm Eliezer Maslia. I'm the director of the Division of Neurosciences, and it's my pleasure to share with you some of the exciting work that we're supporting in collaboration with all our colleagues that you have heard on today. So the next one, please. So the Division of Neurosciences focus primarily on understanding mechanisms of brain aging, as well as Alzheimer's disease and related dementias that include Lewy body dementia, vascular dementia, frontotemporal, and mixed dementias. And we have actually a close collaboration with NIA in this area. Next one, please. And we are very interested in understanding brain aging as well as AD-ADRD, and trying to understand the complex interactions between aging factors, genetic factors, and environmental factors that lead both to protein aggregation, what we call the proteinopathy, A-beta, tau, synuclein, etc., as well as neurodegenerative processes such as synaptic loss, neuronal loss, vascular damage, etc. And as I said, we're really interested on the hallmark of aging and how these processes contribute both to brain aging as well as to AD-ADRD, including processes like cell senescence, DNA damage, immune surveillance, and also how the balance between resilience and susceptibility that is mediated by genetic environmental factors plays a role on these. And finally, we also try to understand all these aging genetic environmental factors in diverse populations and in the context of diversity. Next one, please. And the main focus is, of course, to translate all these basic science and aging genetics and expose them toward developing therapeutics for AD and ADRD, hopefully by the year 2025. And we have programs that expand through the whole spectrum of drug development for AD-ADRD, going from basic research that would lead to target discovery, programs on drug discovery, on animal models, candidate selection, going through programs like the ones that Dr. Huda described to you with SBIR, STTRs for drug development for AD, and finally to clinical trials from phase 1, 2 to phase 3. And we also have a lot of infrastructure supporting studies on the genetics, multiomics, and clinical development. And next one, please. And we also fund a very large network of Alzheimer's centers, 35 centers, as well as an Alzheimer's disease neuroimaging consortia that have developed all these very exciting biomarkers that we now have available in the Alzheimer's field. The focus both of the ADRCs and ADNI has been on diversity and on expanding and validating many of these biomarkers. And all of these data is harmonized and then made available by a coordinating center, which is NAC. And these centers also collaborate with the Alzheimer's disease sequencing program on generating all the genetic data that also is made widely available to everybody through our NIGATS or NIA Genetics Data Storage Unit. And all these centers and networks are interconnected, and again, all of these is available. Next one, please. And in addition, we also have a number of very large consortia that are interconnected that look, for example, at multi-omic aspects of brain aging and AD/ADRD, or going from transcriptomics, metabolomics, lipidomics, etc. Name AMP-AD. MOVE2 is cardiovascular and cerebrovascular involvement in AD/ADRD, resilience AD, neuropsychiatric symptoms. Model AD has developed all these very exciting models of the late onset disease that are made publicly available. And our latest consortia is Treat AD, which are centers for new medicine, developing all these targets that have been developed through AMP-AD and all the other programs that I mentioned. And the most important thing to remember here is that all these very, very rich data at multi-omic levels is made publicly available pre-publication through the AMP-AD knowledge portal and through Agora. So anybody could really do research and request this information. Last one, please. So just remind you to, if you want to learn more about what we do, to please visit our website, and also feel free to contact me if you have any questions and you want me to put you in contact with any of the program directors within the division that could help you with your grant applications. And with that, I pass the baton to our next speaker, that is Dr. Stacy Carrington-Lawrence from the Division of Aging Biology.
Good afternoon, everybody. Hi, as Eliezer mentioned, I am the Deputy Director within the Division of Aging Biology, and I'm going to give you a brief overview of our division. Next slide, please. So the mission of DAB is to elucidate the basic biochemical, genetic, and physiological mechanisms underlying the processes of aging and age-related changes, and we do this across the spectrum of organisms, including humans and animal models of human aging. Next slide. Our division is organized around 3 branches, as well as division director's office. And I'll give you a brief overview of each of our branches. Next slide. So the cell biology branch focuses on elucidating the molecular, biochemical, and cellular mechanisms underlying aging and age-related dysfunctions. Max Guo is the branch chief for this branch. And it also includes 3 program officers, Yigwei Fidel, who focuses on metabolic regulation, including mitochondrial dysfunction, Viviana Perez, who covers the cell biology program, which includes things like cellular senescence, proteostasis, as well as other aspects of cell biology. And then Leonid Sapp focuses on emerging technologies, including imaging, organoids, other types of emerging technologies of interest to the aging field. Next slide, please. There's a couple of FOAs currently out. The 3 interconnected FOAs focuses on interactions of aging hallmarks as a framework for innovative research in aging biology, and I've listed them here for anyone who may have an interest in this type of research. Next slide. We also have the aging physiology branch. Currently, I am the acting branch chief for this branch, which focuses on supporting research on fundamental mechanisms of aging, related changes that alter function in various tissues and organ systems that contribute to conditions and diseases of aging. The program officers within this branch include John Williams. He has a portfolio that includes issues around musculoskeletal and bone diseases and dysfunction, as well as kidney related issues in aging. He also focuses on reproductive and endocrine aspects of aging. Dr. Hongwei Gao is the program officer who covers the circulatory and pulmonary systems within the division. including cardiovascular, lung, and other aspects related to circulatory systems. Dr. Mulu Kilahun is our program officer focused on various aspects of immunology, including age-related changes that impact vaccine efficacy and other immune parameters that change as we age. Next slide. So some areas of interest for this group include understanding interactions across physiological systems, which we refer to as integrated physiology. This would include areas such as communications across systems, inter-organ communication as well. We're also interested, as I mentioned, immunity in aging, and to expand our understanding of age-related changes that occur in immune function during the aging process. In fact, some of the research that we've supported in the past in animals has demonstrated that aging of the immune system impacts aging of all physiological systems. And this reaches back to sort of our approach around integrated physiology and the interactions that impact systems across the body. Next slide, please. Finally, the biological resources branch manages and maintains and provides resources needed to support aging research. Some of these resources include the intervention testing program, the cannabiditis intervention testing program, several aged rodent colonies that they manage and that provide access to investigators in the field. They also oversee an animal models program that's focused on identifying, developing, and characterizing new animal models. And Francesca Macchiarini is the branch chief for this division. Program officers include Manuel Moro, who covers non-human primate and comparative biology programs, Tiziana Cogliati, who covers gerotherapeutics, and Jennifer Fox, who looks at environmental and midlife stresses programs. And we also have Heidi Brogdon, who is health specialist that manages the distribution of the age-related colonies. Next slide, please. Some areas of interest for this group include improving resilience across the lifespan, impacts of the environment on health at older ages, and ongoing programs for identifying animal models that are suitable for studies in aging. Next slide. So as I mentioned, we also have some programmatic aspects within the division director's office that include the training and workforce diversity programs in order to attract new investigators to research in the biology of aging. We also encourage multidisciplinary collaborations across various aspects of aging research. We are currently trying to increase and support and promote human subjects research as well as health disparities research. And we also lead the Neurosciences research program at NIH, including the NIH, Trans-NIH Neuroscience Interest Group. And the members of the division director's office include health specialist Tracy Cope, who is focused on some of our IT and related activities. Pragati Katyar, who leads or manages the Common Fund Cellular Senescence Program, and Tim Morrison, who handles all of our coding activities. We also have our office manager, Nini Kandi, and program analyst, Ni Chow, who handles all of our grant funding activities for the office, and a health science specialist, or health science policy analyst, Siobhan Addy, who does a lot of our policy and scientific communications activities. Next slide. Some of the areas we would like to promote, as I mentioned, is health disparities. This includes understanding the biological aspects of aging-related health disparities across the spectrum from heterogeneity of aging and rates of aging through integrated physiology and the hallmarks of aging. We also have a strong focus on neuroscience. Next slide, please. And the goal of our geroscience is to identify the molecular and cellular causes of aging, to treat aging-related deficit accumulation, reduce disease, preserve, restore, or improve function at older ages, and to ensure geroscience advances benefit all people and reduce health disparities. Next slide. So thank you. I rushed through that a little bit, but if you want to reach out to us, please visit our website, and that's located at nia.nih.gov/research/DAB. Thank you.
Thank you. Well, let me step in here to thank all the speakers for their very effective presentations. And to summarize, if there's one message in common from all of us, it's please, during the rest of our meeting together, but in addition, at any point, one line, best advice is do not hesitate to get in touch with us. We're here to work with you to promote the very best science. And if you can't figure out who else to contact, please get a hold of me. We'll all work to find the best match for you with program officers who can best help to you advance your career and promote your science. And now it's my pleasure to introduce Rhian Miner, the moderator who's representing the American Geriatric Society. She is assistant professor of medicine at Yale. She received funding from NIA and some of the programs you've heard about, the GEMSTAR and the Beeson programs. She previously served as chair of the Junior Faculty Research Special Interest Group at AGS, and now is the liaison for the group on research on the research committee. Dr. Miner, we're pleased to have you lead our discussion from this point.
Okay, so I think this is perhaps one of the most important parts of this is for all of you who are listening to be able to ask your questions. And so you can do so by putting a question in the chat. You could also raise your hand. And so while I'm waiting for some questions to pop up, I'll say a couple things. So we're going to have maybe about 10 minutes for these general questions, and then we're going to have different breakout rooms. And so those breakout rooms will allow you all to choose what division you might like to go into to have some more kind of one-on-one contact with the people who are presenting today. And then I also want to say that, I remember being in your shoes, just maybe, getting started and feeling very intimidated by these people and this whole process. And what I learned through the Butler Williams Scholar Program and, doing the GEMSTAR and the Beeson applications is that these people are here to help you. They want you to submit, they want you to do aging research and to submit your grants to the NIA, and they want you to submit the best grant possible. So they're really here to help you be successful. And so hopefully you all feel comfortable asking some questions. Okay, so here we go. I want to learn more about how grants are reviewed. Are new investigators allowed to be part of the grant review process? Okay, great question. And there is a program for that. And I don't know if there's anybody in particular who wants to talk about that. Dr. Santora, I see you coming on your video. Did you want to address that?
Yeah, this is a great question. And we, just to let everyone know that we do try to have a balance on our study sections. So CSR has standing study sections. We at NIA have our own standing study sections, and they're made up of members throughout all the career enrollment. We even try to have people come in, junior faculty especially, to be ad hoc members to get an idea of how to review applications and then become, permanent members later on. So it kind of gets tried out in that way. So I always suggest talk to your program officer, that you can get nominated into our website, in which we have a database that we collect names and expertise for our panels. So we're always in search of new people to help with our review process, because it's one of the most vital, I think, functions that we have here at the NIH is our peer review system and the fairness of it and the importance of it. So I highly encourage you to reach out to any of us, and we can add your names to our pool of potential reviewers.
Excellent. And I can see that the link for becoming a reviewer is now in the chat, so you can check that out. It just will sort of specify what the requirements are. And it's a pretty easy process to apply for. Okay, so we have a few more questions, but before we go to the next question, I wanted to ask, once upon a time when I did Butler Williams, there was a mock study section as part of that. Is that still the case? I don't know if Dr. Jones wants to address that.
Excellent question. And yes, the mock review session is a component of the Butler Williams program that has not changed irrespective of the format and delivery from in-person to virtual. Yes.
Okay, thank you. Yeah, so that's another great opportunity. So we have a question. Can you receive a K-76 after having received a K-01 or K-23? I believe the answer is yes, and I'm not sure who's the best person to talk about transitioning to a BSIN. Anybody want to take that question on?
Sure, this is Maria Carranza. So you are correct, Dr. Miner. The answer is yes. At the same time, you want to make sure that you strongly justify the need for an additional 5 years of career development in aging, because reviewers will consider how many years of career development you've already had. So the rationale should be compelling. Thank you.
Okay.
And just another to back that up is you can always apply for a regular R01 also. You know, you likely will have your ESI status at this point still. And it's like we said, several different talks, there's a different pay line. It's a greater pay line. So the likelihood is even greater of getting the R01. So you can, and it's very similar to the K-76 program too.
Okay, so sounds like a good opportunity to talk to your program officer and find out which is the best fit for you. Okay, so we have another question, which actually kind of relates to this point. My last eligible cycle for Oh, sorry, did somebody want to ask a question? Okay, so my last eligible cycle for K99 is this October, as the general idea of my project may also fit the R01 CATS opportunity. Would I be allowed to use a new version of the same project for the R01 CATS in the future?
Thank you. That's a great question. So as you all know, applicants cannot have two applications with overlapping aims under review at the same time.
So, meaning to, as a follow-up then, to if you do apply and you do not get funded in that cycle where the council comes, you can apply again the next cycle. And yes, you can, you know, if you did not get funded, the emphasis here is overlap. You can't get funded, obviously, for the same science. And so you have to be very careful about how you're writing your application. And it's sufficiently different from another application that got funded now. So if it didn't get funded, you're absolutely welcome to apply to and write your application into the way it should be for that particular funding opportunity announcement. And even though the aims may be very similar. So you can do that, but just not in the same round, and it can't be overlapped with any funded application.
Okay, so the chat is popping up with many questions. Let's see what we can get to before the breakout. So one person is asking about getting feedback for an application for Butler Williams. Dr. Jones.
Yes, and I just put my response in the chat for everyone to see.
Oh, excellent.
As I mentioned in my remarks, it is not uncommon for applicants not to be selected for Butler Williams. It remains to be a very, very competitive program, and we're happy to provide whatever insight we might be able to provide. Just contact me using that email, and we'll connect you to the appropriate party, and we'll get you some solutions.
Okay, excellent. So then let's talk about this one. This is probably good for the group. If a proposal is focusing on cancer-related aging, should it go to the NCI or the NIA? So I think that's probably a question a lot of people are wondering is when is it NIA and when is it maybe a different institute?
Well, I'll jump in and start. The short answer is it really depends. Please send us your aims, reach out to a program officer, and we're happy to talk with you. But in general, if the focus is really on aging, on functional outcomes, geriatric syndromes, the kinds of things that we think about and focus on in aging, if that's really the focus, then it would likely come to us. If the focus is more about cancer outcomes and the aging component may not be quite front and center, that's probably an NCI application. But again, to be sure, we're happy to talk to you about your aims and give you guidance.
All right. Next question. If I have a KO1 awarded during my postdoc and then I'm offered a promotion to research assistant professor, how does this work? Can I accept the promotion? If so, can the KO1 budget be adjusted to cover the salary?
So I'll start off by just saying that you should please work with your grants management person assigned to your application. Ask them, because each type of grant has specific caps on salaries sometimes, eligibility, and if it changes in those cases, you may or may not be allowable. So what I would most recommend is to please contact the grants management person, specifically ask those questions, and they will tell you exactly what's allowable in that particular grant and at your stage in your development. So yeah, I think that's probably the best way to answer that question for across the board in general. If very specific, if you have some sort of change in your career development during one of these career grants, there's very specific requirements for each one of them, and you have to abide by them, and it may or may not be applicable to you. So they'll know exactly, or you can reach out to Maria's group also in that question, and they will research it for you for your particular grant. Then you can give them your grant number, et cetera, so they can understand which one you're applying to, have applied to.
Okay, thank you. So let's do one final quick question before the breakout groups, which I think is going to be for Dr. Carranza. Are non-tenure track faculty eligible for K-22 awards? I believe you addressed that. I think the answer is yes, right?
The answer is no.
Oh,
K-22 awards are for postdoctoral fellows in training non-independent positions. As soon as you become independent, then the K-22 career transition no longer applies to you. Thank you.
Okay, so now we're going to do the breakouts. And so hopefully most people are familiar with how to join these breakout sessions. There are people here to help you. Again, we're going to do the different divisions that have been part of this presentation today. And you do have the ability to leave that breakout room and go to a different breakout room if you decide.